Good day, everyone. I am Dr. Richard Condor, an orthopedic spine surgeon practicing here in Cebu at the Cebu Orthopedic Institute. I was tasked to give a talk on musculoskeletal system. The intended learning outcomes will be as follows. At the end of this talk, we will be able to discuss appropriately the types, functions, and examples of cartilage. Second is to explain correctly the classification, functions, structure of bones, and its pathophysiology in the skeletal system. And thirdly, to demonstrate accurately the types, characteristics, and functions of muscles and its pathophysiology in the muscular system. Let us start with the cartilage. To begin with, the cartilage is a resilient and smooth elastic tissue, a rubber-like padding that provides support, cushion, cover, protection of the ends of long bones at the joints. And it is a structural component of the rib cage, the ears, the nose, the bronchial tubes, and the intervertebral disc, and many other body components. It is not as hard and rigid as bone, but it is much stiffer and much less flexible than muscles. The matrix of the cartilage is made up of glycosaminoglycans, proteoglycans, collagen fibers, and sometimes elastin. Because of its rigidity, cartilage often serves as the purpose of holding tubes open in the body. A good example are the rings of the trachea, such as the cricoid cartilage and the carina. A cartilage is made up of some variety of tissue molded to fit its body location and function. It consists primarily of water, which accounts for its resilience. There are no nerves nor blood vessels present in the cartilage, but it is surrounded by a layer or a dense irregular connective tissue called the perichondrium, which contains blood vessels. So this usually relies on diffusion for the nourishment of the cartilage. That is why when the cartilage gets injured, it is very slow to heal. The main cell types are the chondrocytes, where the ground substance is the chondroitin sulfate. The fibrous sheath is called the perichondrium. So chondroitin sulfate, which is an important structural component of cartilage, provides much of its resistance to compression. That is why people who have osteoarthritis of the knee or any other joints, doctors usually give tablets of chondroitin sulfate because it's an important structural component of the cartilage. There are three types of cartilage, namely the hyaline cartilage, the elastic cartilage, and the fibrocartilage. Most abundant is the hyaline cartilage. It provides support with flexibility and resistance. They are found in ends of bones and resembles glass-like appearance. So bone begins as a hyaline cartilage in the young individual and later on calcifies or ossifies when they get older. The next type of cartilage is the elastic cartilage. It contains more stretchy elastic fibers. There are only two examples, namely the external ear or the pinna and the epiglottis. And the third type of cartilage is what we call the fibrocartilage. This is highly compressible with great tensile strength. It has many collagen fibers and is found in the spinal column or the vertebral column. It's found in between the vertebral body, called it the intervertebral disc. It is highly compressible. It acts as a shock absorber to the spine. These are the images of microscopic views of the different types of cartilage, namely the elastic on the left side, hyaline on the middle, and fibrocartilage on the right side. The elastic cartilage has the most extracellular matrix, which provides more elasticity to the to this type of tissue. So the more extracellular matrix, the more elastic it is compared to the fibrocartilage, which has the least amount of extracellular matrix. Now, after the talking about the cartilage, we go now to the bone tissue. The bone is a rigid body tissue consisting of cells embedded in an abundant hard intracellular material. The two principal components of bone is the collagen and calcium phosphate. So collagen and calcium phosphate. This will distinguish bone from other hard tissues such as enamel, which is found in the teeth, chitin, and shell. So these other types of hard tissue doesn't contain collagen or calcium phosphate. It's only found in the bone. Bone tissue makes up the individual bones of the human skeletal system and the skeleton of other vertebrae. There are different types of classification of the uh, bony tissues. Bone. First classification is according to its location. So we classify them according to location into two: axial skeleton and the appendicular skeleton. The axial skeleton is the one uh, in the center or along the long axis of the body. So it's composed of the skull, the vertebral column, and the rib cage. The function of the axial skeleton is for support, for protection of the vital organs of the body, and to carry other body parts. The next type of the next type in this classification of bone, which is according to the location, is the appendicular skeleton. These are composed of the upper and the lower limbs and the pelvic girdle. So the appendicular skeleton uh, functions for locomotion, so for movement and manipulation of the environment, meaning we can carry, we can move something or change the environment using our appendicular skeleton. Another classification of bone is according to its form. So we have four types. According to form, we have the long bone, the short bones, the flat bones, and the irregular bones. Long bones are longer than wide. It has a shaft and two ends, which are often expanded. All the limb bones except the ones in the kneecap and the wrist and ankle bones are long bones. So with the exception with the patella, the wrist and the ankle bones are called long bones. So this one is an example of a long bone, the humerus, which has a shaft, the one here in the middle, and two expanded ends, the proximal end and the distal end, expanded end. So this is an example of a long bone. Another type of bone in this classification are the short bones or roughly cube-shaped bones. These are the bones found in the ankles and on the wrist. So they vary in size and number in different individuals. A good example is the short bone on the ankle, which what we call the talus bone. It's a cube shape, the talus, and other part of the tarsal bones and bones of the wrist. So another type in this classification, according to form, is the flat bones. So they are thin, flattened, and usually a bit curved. So a good example is the sternum or the breastplate, the sternum, the scapula or the shoulder blade, and the ribs, and most of the skull bones. So the skull bones are what we call flat bones also. And then the last classification in this classification is called the irregular bones. So they are complicated shapes that don't fit any of the preceding cases. They are not long, they are not short, they are not flat. But they are called irregular bones. Their examples are the bones on the hip and the bones on the vertebral column. So they are called irregular bones. Again, example is the vertebra. This is the lateral view or the side view of the lumbar vertebra. So I think that's L1 or lumbar 1. Now we go to the functions of bones. So what are the different functions? We have 7 different functions of bones. First function is for support. Bones provide a framework that supports the body and cradles its soft organs. So it provides support of the body. So second function is for protection. As I mentioned earlier, the fused bone of the skull, which are flat bones, they protect the brain. The skull protects the brain. The vertebral column surrounds or protects also the spinal cord. The rib cage protects the vital organs of the thorax, which are namely the heart and the lungs. So they protect vital organs. So one of the function is for protection. Third function of the bone is for movement. The skeletal muscles attached to the bones by tendons and ligaments, they use the bones as levers for locomotion or for movement. So one of the function is for movement. The fourth function of the bone is for mineral and growth factor storage. So they act as storage of the minerals, namely, most importantly, the calcium and the phosphate minerals. So they act as a reservoir for the important minerals of the body, calcium and phosphate. The next function is for blood cell formation or hematopoiesis or red blood cell formation, which occurs in the red marrow cavities of certain long bones. The bone marrow, which acts as a hematopoiesis or blood cell formation. Bone marrow in the iliac crest or the bone marrow in long bones, especially in younger individuals. The next function is the triglyceride or fat storage. So usually fat is stored in bone cavities. Long bones in adults, instead of having bone marrow cavity, red marrow cavities, they store already triglycerides or fat, especially in the adults. The last function of the bone is for hormone production. So bones produce osteocalcin, which is a hormone which helps regulate bone formation, protects against obesity, glucose intolerance, and diabetes mellitus. So here bone produces hormone called osteocalcin. So those are the 7 functions of bone. So bone structure. So bone usually has a general structure. It's composed of a compact bone and the spongy bone. This is an example of a flat bone on the skull, which has 2 layers. The outer dense layer, which is smooth and looks solid, is the compact bone, or what we call the cortical bone. Another name for it is a cortical bone or the cortex. So we have 2, in a flat bone, we have 2 inner and outer cortical or compact bones. And the inner part, the middle of it, is the spongy bone, which is also known as a trabecular bone. or a diplo, or a cancellous bone. It's a soft type of bone. It's less solid, less compact. It's spongy bone. So it's a honeycomb of small needle-like or flat pieces of bones called trabeculae. That's why it's called trabecular bone. Like this one. This is trabeculae spongy bone or a diplo. So this is a flat bone consists of an outer layer of a layer of spongy bone sandwiched between two thin layers of compact bone. So the inner layer of compact or dense outer bone and the outer layer of compact bone. So those are the bone structures, no? Two bone structures, the compact bone and the spongy bone. So the structure of short or irregular and flat bones, usually the three, the short bones, the flat bones, and irregular bones, consist of thin plates of spongy bones covered by compact bones. So an example for flat bones are the bones of the skull. They are spongy bones covered by compact bone. Sandwich, na spongy bone sandwiched by compact bone. These bones are not cylindrical and so they have no shafts or epiphyses. So they contain bone marrow but no well-defined marrow cavity. So they contain bone marrow or the spongy bone but they have no well-defined marrow cavity. So the structure of long bones or the typical long bones, because a while ago we were discussing about short, irregular, and flat bones. Now, the structure of long bones, no, long bones, with a few exceptions of all long bones, they have a general structure. They have a shaft, which is called the diaphysis. The bone ends, we call it the epiphysis, and the membranes. So the diaphysis or the shaft forms the long axis of bones, which is a thick collar of compact bone that surrounds a central medullary cavity or marrow cavity. In adults, the medullary cavity contains fat, and it is called the yellow marrow cavity. In uh, younger individual, the medullary cavity contains a red marrow. So in adults, it's already fat, while in children, they contain red marrow, which is hematopoietic for function or red blood cell formation. So another part of the diaphysis is the periosteum. It covers the diaphysis. So after the diaphysis or the shaft of the bone, another part is the epiphysis or the bone ends, the epiphysis. They have an outer shell of compact bone formed of the epiphysis, exterior and the interior, and contains spongy bones. A thin layer of articular cartilage covers the joint surface. Articular cartilage or the hyaline cartilage, which is the most abundant in the body, the hyaline cartilage. Remember the hyaline cartilage found in the joint or the ends of long bones. The most abundant type of cartilage, the hyaline cartilage. The epiphyseal line, go to the next structure of the long bone, the epiphyseal line. This is usually a remnant of the epiphyseal plate, which is a disc of hyaline cartilage that grows during childhood to lengthen the bone. Or we call this epiphyseal line a growth plate, no? Where growth occurs from childhood to lengthen the bone. The flared portion of the bone where the diaphysis and the epiphysis meet is sometimes called the metaphysis. So where the diaphysis, the shaft, meets with the epiphysis, with the ends, is called the metaphysis. So that's the flared portion of the bone where the diaphysis and the epiphysis meet. And this is the metaphysis. And this is also where the epiphyseal line is also seen. So periosteum is the outer covering of the bone of the external surface of the entire bone except at the joint surfaces because it's covered by the cartilage, the hyaline cartilage. It is an outer fibrous layer which cover the dense irregular connective tissues, no? The periosteum. So this is the the outer portion of of the bone of the diaphysis. This is the periosteum. The inner or osteogenic layer of the periosteum, close to the bone or abutting the bone surface, consists of primitive osteogenic cells. This is also attached by sharp piece fibers, the, the periosteum. This is richly supplied with nerves and blood vessels which pass through the shaft of the bone via the nutrient foramina. So there's a hole on the bone wherein the blood vessel penetrates or passes through, which is called the nutrient foramina. So the location of the hematopoietic tissue. In newborn infants, the medullary cavity of the diaphysis or the shaft and all areas of spongy bone contains red bone marrow. When they are already in adult, most of the long bones that already contain fat, no, medullary canal, which extend into the epiphysis. So from the diaphysis or the shaft goes to the epiphysis or the flare, and there is only a little red marrow present in the spongy bone cavities. This is being replaced by fat. No? From the red marrow in newborn infants, they're replaced by fat or triglyceride storage in adults, fat containing medullary cavity. For this reason, blood cell production in adult long bones routinely occurs only on the head of the femurs and of the end of the head of the humerus. It is not found anymore in the medullary cavity of the long bones or the shaft of the long bones or the diaphysis. So this is a typical example of the structure of a long bone of the humerus of the arm. The flared up epiphysis ends, no? So the proximal epiphysis, the distal epiphysis, the flared ends, and the shaft or the diaphysis. So where the epiphysis and the diaphysis will meet, we call that one the uh, metaphysis. And in the metaphysis, there is an epiphyseal line, which is a remnant of the gross plate, no? The gross plate which is also hyaline cartilage, wherein growth occurs. So when you're an adult already, there is what we call an epiphyseal line or epiphyseal scar. And here is the compact bone or the outer cortical bone, the periosteum. Here, the periosteum which covers the shaft or the diaphysis of long bones, and it contains a sharp piece fibers which anchors this periosteum to the bone. The nutrient arteries which penetrates to the bone or passes through the bone called through the nutrient foramen. The yellow bone marrow in adults, which replace the red bone marrow in infants and small children. So this is the articular cartilage, the hyaline cartilage, partly, and on the epiphysis, while on the shaft or the diaphysis, we have the periosteum. So this is the compact bone or the outer solid compact solid bone, the inner trabecular or the spongy bone with trabecular bones honeycomb appearance, and then the yellow marrow which replaced the red bone marrow, the diaphysis, and the bony markings. We go to the bony markings. They are external. The external surface of bones are rarely smooth and featureless. So they display projections, depressions, sulcuses, openings. uh, These bone markings serves as sites of muscles, ligaments, and tendon attachment, as joint surfaces, or as conduits of blood vessels and nerves. So the bone markings in the humerus, we have the tubercle, the greater and the lesser tubercle. There's a sulcus or a ridge or depression here. There's a tuberosity on the humerus. They call it the deltoid tuberosity, where the deltoid muscle is attached to the diaphysis. There's a linea aspera, the trochlea, the condyles, the fossa, the depressions. So these are bone markings which serves as sites of muscle, ligament, and tendon attachments. So these are some bony markings on the iliac crest, the tuberosities. So tuberosities and the humeral tuberosities, they are large rounded projection. May be roughened. Their attachment of the rotator cuff muscles in the shoulder and the head of the humerus. The crest, the iliac crest, it's a narrow ridge of bone, usually prominent. These are also attachment of your gluteus maximus, and then the trochanter of the femur. You have the greater and the lesser, uh, greater and the lesser trochanter, and there's an intertrochanteric line where in the gluteus muscles are attached. So then the line, there's a linea aspera in the femur, a narrow ridge of bone, less prominent than smaller, less prominent than a ridge where muscles are attached. Tubercle, small rounded projections or processes. Epicondyle, a raised area on or above a condyle, called epicondyle. Spinous process, or sharp, slender, often pointed projection, the spinous process. Any bony prominences in the vertebrae, the facet joints, the condyles, the epicondyle are prominences, raised area above the condyle. The tubercle, the ductor tubercle, the ischial spine, or slender pointed projection, ischial tuberosity, and so on and so forth. And the projections that help form joints of the rib. This is the rib head from posterior to anterior. So these are the facet joints. The head is a bony expansion carried on a narrow neck. There's a narrower area neck. So this is also a facet. Smooth and flat articular surfaces. The condyles are rounded projections like the ones in the mandible. And the TMJ, the temporomandibular joint. This is a condyle. The ramus is an arm-like bar of bone, the ramus of the mandible. There's also a ramus of the pubic bone, arm-like or bar of bone. Depressions and openings, the groove or furrow, fissure, a slit-like opening, foramen, meatus, fossa, notch, groove, this one a furrow where the nerves or the arteries are attached. Orbital fissure where the nerves are located, foramen where vertebral arteries or nutrient arteries or nerves comes or pass through. Meatus is a canal-like passageway. A notch is an indentation of the edge of the structure. Sinuses, cavity of bone filled with air, lined with mucous membrane. Our sinuses, our cavitary sinuses, to filled with air, lined with mucous membrane. Fossa is a shallow basin-like depression in the bone, serve as an articular surface. So we go now to the disease pathology of bone. So osteomalacia and rickets. So osteomalacia are the ones we call it in adults, and rickets are the ones in children. So bones are poorly mineralized, There's no calcium or phosphate mineral deposits. The osteoid is produced, but the calcium salts are not adequately deposited, so the bones are soft and weak. So in rickets, the epiphyseal plates cannot calcify, they continue to widen, and the ends of long bones become visibly enlarged and abnormally long, like these examples of rickets in children. The ends or the epiphyses are expanded, and then they are wide. They are not. They are poorly mineralized. Uh, they are not adequately deposited with calcium. The bones are soft and weak, so they cannot calcify, and they continue to widen. So, and they are abnormally long, curved, and weak. This is the example of rickets in the leg, the tibia. This is the tibia, the fibula. The ends are widened, they're weak and curved. We go now to the axial skeleton. So the axial skeleton, as I mentioned a while ago, is the one in the along the long axis of of the skeletal system, the one in the middle. So it is composed of the skull, the vertebral column, and the rib cage. This is the axial skeleton. This is the front view and the back view. So the rest are the appendicular skeleton. So the axial is on the long axis. So the skull is the body's most complex bony structure. The cranial and facial bones, so the most skull bones are flat bones, a little bit rounded or curved, except for the mandible, which is connected to the skull by the joints. All the bones of the adult skull are firmly united by interlocking joints called sutures. So this is the frontal bone, the parietal bone, the temporal bone, the maxillary bone, the zygomatic bone. So they are connected with each other, firmly united by interlocking joint called the sutures. This is the mandible. This is the mental foramen, the mandible, the ramus of the mandible, the joints. This is the back view of the skull and the side view of the skull. So you notice there's the parietal bone and the temporal bone and the occipital bone. So they are connected firmly with what we call sutures. So we call this, they name the sutures depending on the name of the bone. So parieto-temporal suture, the occipital, and then the mastoid suture. So these are the mastoid process, the styloid process. The mastoid process is where the sternocleidomastoid muscle is attached to. This is the condyle, the TMJ, the temporomandibular joint, the mandibular notch, the mandibular ramus, or the arm-like or bar-like part of the bone, the mandibular angle. These are all flat bones connected with each other. The ethmoid bone, the lacrimal bone, the lacrimal fossa, nasal bone, zygomatic bone, the maxilla. This is the back portion of the spine. This is the occipital bone. These are the ridges or the markings of the bone, the external occipital protuberance, the superior nuchal line, the external occipital crest, the inferior nuchal line, the mastoid process of the temporal bone, the sagittal suture, the coronal suture. All of these are parts of the bone of the axial skeleton. The next part of the axial skeleton is the vertebral column. So the the spine. So consists of 26 irregular bones connected in such a way that the flexible curved structure results. No? So the axial support of the trunk, that's the function of its support of the trunk, It extends from the base of the skull to the pelvis where it transmits the load or the weight of the trunk to the lower extremities. It surrounds and protects the spinal cord. That's the function of the vertebral column. It supports the trunk, it protects the spinal cord. It provides attachment points of the ribs and for the muscles of the back and the neck. So there are four. So we go to the parts of the vertebral column. We have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, and fused vertebrae, no? And then 4 fused coccygeal vertebrae, or terminus. The terminus or the end is the coccyx. The sacrum also articulates to the hip bone. There are 4 curvatures of the spine on the sagittal or the lateral view. You have concave posteriorly, the cervical and the lumbar curvatures. And then there's also a convex posteriorly, the thoracic and the sacral curvature. These curvatures increase resiliency and flexibility of the spinal or the vertebral column. It increases the resilience or flexibility. So the thoracic cage is the third part of the axial skeleton. The first one was the skull, the second one was the vertebral column, the third is the thoracic cage. Components of the thoracic cage are the posteriorly is the thoracic vertebrae. We have 12 thoracic vertebrae from T1 to T12. The sternum on the front, so we have the manubrium sternae and the body of the sternum. And laterally on the sides are the ribs. So we have 12 ribs on each side, 24 all in all. So we have 7 true ribs from T1 to T7 and false ribs from T8 to T12. So they are connected from the back through the vertebral column, from the head of the rib connects to the articular surface of the vertebral body, to the facet joints, to the transverse processes, and then it goes anteriorly and connects to the sternum through the cartilages. So call this one hyaline cartilage, or the costal cartilage, costochondral cartilages. So costal margins. There are 2 floating ribs, T11 and T12. The sternum, the body of the sternum, the manubrium sternae, the xiphoid process. So these are the parts of the thoracic cage, the function of which is for protection of the vital organs of the body. Protective cage around the vital organs of the thoracic cavity, namely the lungs and the heart. And the function also of the thoracic cage supports the shoulder girdles and the upper limbs. It also provides attachments of many muscles of the back, the chest, the shoulders, the neck. And so that's the function of the thoracic cage. So from the axial skeleton, we go now to the appendicular skeleton. So this one is for locomotion. For the sides are not along the long axis, so it's the appendicular, the appendages. So the pectoral or the shoulder girdle, it includes the clavicle, the scapular or the shoulder blade posteriorly, clavicle anteriorly. It attaches the upper limb to the axial skeleton, to the rib cage. So it provides attachment of the muscles that moves the upper limb. So Then next to the shoulder girdle is the arm. The bone that's connected to the arm is the humerus. We have the uh, head of the humerus, the tuberosity, the greater and the lesser tuberosity, the intertrabecular sulcus, where the bicipital or the bicipital groove, where the long head of the biceps passes through, the shaft or the diaphysis, and then there's a deltoid tuberosity where the deltoid muscle is inserted, and the flare is the metaphysis or the epiphysis here, called it the lateral supracondylar ridge, the radial fossa, where the radial head uh, approximates to, the capitulum, where the radial head also articulates, the trochlea, where the olecranon articulates also. So this is the front view, the back view of the humerus. So here we have the head of the humerus. There's a anatomical neck and the surgical neck. The surgical neck is where the mostly fractures occur. So this is the back, and then this is the radial groove where the radial nerve passes through. And then this is the deltoid tuberosity where the deltoid muscle is inserted to. The supracondylar, medial and lateral supracondylar ridge, the olecranon fossa, where the olecranon approximates to. This is the posterior view. The olecranon, part of the ulna, radial head, lateral epicondyle, medial epicondyle, the humerus. And then this is the front view or the anterior view of the elbow, where you have the capitulum, the trochlea, where uh, the olecranon also approximates or like a hinge joint. The capitulum, where this one will uh, catch the head of the radius, the coronoid fossa, and then the medial epicondyle. So the markings of the bone. Another part of the upper limb is the forearm, below the elbow and above the wrist. We have two bones, long bones, the radius on the lateral side and the ulna, the medial side. So it's connected with the interosseous membranes, the radial head, the olecranon, and then the interosseous ligament and the distal radioulnar joint. This is the distal end of the radius and ulna, where the carpal bones articulates, the articulation of the lunate, articulation of the scaphoid, the radial styloid, and the ulnar styloid. This one is the proximal portion of the ulna, the lateral view, the olecranon, the trochlear notch, the coronoid process where it will meet the coronoid fossa. There's a radial notch where in the head of the radius will approximate to the ulna, radial notch of the ulna, where the head of the radius will approximate. And then part of the upper limb is the hand, or the carpus, or the wrist, and the metacarpus, the metacarpal bones, and then the phalanges, small fingers. So we have 8 carpal bones, so 4 on each row. The hamate, the capitate, and the distal. The hamate, the capitate, the trapezoid, and the trapezium. Well, the proximal row of carpal bones are the scaphoid, the lunate, the terpetrum, and the pisiform. And these are the uh, metacarpal bones. We have 5 metacarpal bones. And then the phalanges, we have 5 proximal phalanges, middle phalange, 4 middle phalanges, and 5 distal phalanges. So all in all, we have in one carpus we have 14 phalanges, and 5 metacarpal bones. The sesamoid bones are small bones in the part of the near the joint of the thumb, the sesamoid bones. Sesamoid bones. Posterior view of the hand. This is the front view, anterior view of the hand. So in summary, for the appendicular bones of the upper limb, we have the clavicle, the scapula, the humerus, the elbow joint, the forearm, the radius and ulna, the wrist, the carpal bones, the metacarpals, and then the phalanges. You know? So glenoid cavity, the markings, the location. And then we go now to the lower limb, part of the appendicular skeleton, the pelvic girdle, the pelvis. It attaches the lower limb to the axial skeleton. It transmits the full weight of the upper body to the lower limb. It supports the visceral organs of the pelvis, the reproductive organs of the female, the visceral organs of the gastrointestinal tract. The two hip bones are connected to the sacrum in the posterior part. So we have the hip bones are the ilium, the ischium, and the pubis. So we have the pubic ramus, the ischium, the pubic arch, the symphysis pubis also here. Iliac fossa. Sacrum and coccyx behind. It's the base of the sacrum or the sacral promontory. It's part of the pelvic girdle. And then we go to the lower limb, the thigh bone, the femur, which is the largest and the longest and the strongest of the bone, all the bones of the body. So we have the femoral head, the femoral neck, the greater tubercle, the trochanter, the lesser trochanter, the intertrochanteric line, the gluteal tuberosities, the linea aspera. Those are the markings. And then the intercondylar fossa, the medial and the lateral condyle, the tubercle, the adductor tubercles, the epicondyles, and then the patellar surface. The ends are usually covered by hyaline cartilage. So this is the shaft or the diaphysis, the epiphysis, the metaphysis. This is the front view and the posterior view of the right knee and thigh. So the lower limb, the leg, composed of two bones, the tibia on the medial and the fibula on the smaller one on the lateral side of the leg. It's connected by interosseous ligament. The proximal part, which is called the tibial plateau, we have the intercondylar eminence, the lateral condyle, the medial condyle, and then the head of the fibula. There is a superior tibiofibular joint, the shaft of the fibula, the lateral malleolus, part of the fibula, the inferior tibiofibular joint, the medial malleolus here. So those are the part of the leg, the bones of the leg, tibia and the fibula. Then we go to the foot, the tarsal bones, the metatarsals, and the phalanges. So the tarsal bones, namely the calcaneus, the talus, the navicular, the three cuneiforms, and the cuboid bone. The cuboid, the navicular, the cuneiforms, the calcaneus or the heel bone, the talus, and then the metatarsal bones, and then the phalanges. So those are the bones of the foot. So we go now to the skeletal From the skeleton, we go now to the skeletal muscle. So, so there are three types of muscle tissues: the skeletal muscle, the cardiac muscles, and the smooth muscle. Skeletal muscles have the longest muscle cells and have obvious stripes called striations. The only type subject to conscious control or voluntary control. This is the only type of muscle that we can do voluntary control, responsible for overall bodily mobility. It contracts rapidly but tires easily and they have to rest. The cardiac muscle, of course, only in the heart. They are striated or has stripes but are involuntary. And then the third type of muscle is the smooth muscle, found in the walls of the hollow visceral organs such as the stomach, the urinary bladder, the respiratory passages. They have no striations and are also involuntary like the cardiac muscles. So the key words are skeletal muscles. They are skeletal, striated, and voluntary. Cardiac, they're cardiac, striated also, same as the skeletal, but is involuntary. And the smooth muscles are found in the visceral organs such as the stomach, the urinary bladder, and the respiratory passages. They are non-striated or there's no stripes and are also involuntary like the cardiac muscles. So characteristics by body locations of the skeletal, they are attached to bones and some facial muscles to the skin. The cardiac or the walls of the heart, also location, and smooth muscles, they are the urinary muscles wall of the hollow visceral organs of the multi-unit muscles intrinsic in the eyes, the airways of the lungs, the large arteries, the eye muscles. There are also smooth muscles. They are involuntary. Same with the cardiac. Only the skeletal is the voluntary. The cell shape and appearance. The skeletal, they are single, very long, cylindrical, multinucleate, lots of nucleus with obvious striation or stripes. These are the stripes in the skeletal muscles. The cardiac muscles, a branching chain of cells, uni or binucleate, so a nucleus is only one or two, still with striation or stripes. They're not cylindrical, they are branching like this one. And then the smooth muscles, they are single, fusiform. This is the form of the smooth muscles, fusiform, uninucleate, and has no stripes or no striations. Characteristics of muscle tissues: excitability, the ability to receive and respond to stimulus; contractility, the ability to shorten forcibly when inadequately stimulated; extensibility, ability to extend or to stretch; elasticity, the ability to muscles to recoil and resume its resting length after stretching. So excitability meaning respond to stimulus, contractility, shorten, extensibility to stretch, elasticity, ability to recoil and resume the resting state. So functions of the muscles for producing movement. Just about all movements of the human body and its parts result from muscle contraction. So it usually produces movement. Maintaining posture and body position, like while you are sitting right now in your computers, you maintain your posture and body position. It's the function of the muscles, stabilizing the joints, and even as muscle pulls on bones to cause movement, they stabilize and strengthen the joints of the skeleton so you won't fall. If ever you stand on one foot, other muscles will stabilize it. So those are the functions of the muscles. Another one is to generate heat. Muscles generate heat as they contract because skeletal muscles account for at least 40% of body mass. It is the muscle type most responsible for generating heat. So 40% of Body mass is by the skeletal muscles. It can generate heat. So the anatomy, we'll talk about each type of muscles one by one. So anatomy of the skeletal muscle, the nerve and blood supply. In general, one nerve, there is one artery, and one or more veins serve each muscle. So one nerve, one artery, but one or more veins. The connective tissue sheath, the epimysium, surrounds the whole muscle. The perimysium, muscle fibers are grouped into fascicle, and the endomysium surrounds each individual fiber, muscle fiber. One motor unit is one motor neuron and all muscle fibers it supplies. So this one is the anatomy of the skeletal, cardiac, and smooth muscles. So soft tissue component, the epimysium is the one that covers the entire muscle fascicle. The perimysium, this one here, and then the endomysium, so individual muscles, and then the presence of myofibril composed of sarcomeres. With the cardiac, the endomysium is attached to the fibrous skeleton of the heart, the endomysium, skeleton, the skeleton of the heart. While in smooth muscle, only endomysium. While skeletal has three connective tissues, epimysium, perimysium, and endomysium. Cardiac has endomysium, and the smooth muscles of the visceral organs on the endomysium. Presence of myofibrils, yes, called sarcomeres. In the cardiac, they also have myofibrils, regular in thickness, but the smooth muscles, they don't have the presence of myofibrils. They have actin and myosin filaments are present throughout the dense body that anchors actin filaments. Presence of T-tubules and site of invagination, yes, for the skeletal muscle. This sarcomere, at A1 junctions, there is a T-tubule, one sarcomere. And then in the cardiac muscles, there's also presence of T-tubules in the sites of invagination, one in each sarcomere, and the Z disc larger diameter than those of the skeletal muscle. While the smooth muscles in the visceral organs, they don't have presence of T-tubules. No, they only cavulate. Only cavulate. Skeletal muscles, cardiac and smooth muscles, elaborate sarcomere retinaculum. Sarcoplasmic, yes, in skeletal muscle, less than skeletal muscle, equivalent to cardiac muscles, 1 to 8% of cell volume. Presence of gaps, no gaps in the skeletal muscles. Cardiac muscle, yes, they are intercalated with disc. And then in smooth muscle, yes, there is a presence of gap junctions in unitary muscles. The cell exhibits individual neuromuscular junctions, so one neuromuscular junction per one skeletal muscle. Yes, so in cardiac, there's no individual neuromuscular junction. In smooth muscle, not in unitary muscle, but yes, in multi-unit muscle. Regulation of contraction. This is voluntary in skeletal. Axon terminals of the somatic nervous system. The cardiac is involuntary, intrinsic regulation. Also, autonomic nervous system controls the heart, hormones, and stretch. The smooth muscles are the visceral organs. They are also involuntary. They are controlled by autonomic nerves, hormones, local chemicals, and stretch also. So skeletal, cardiac, and smooth muscle, source of calcium for calcium pulse, sarcoplasmic retinaculum in the skeletal muscle. For the cardiac, sarcoplasmic retinaculum from extracellular fluid, And for smooth muscles, they have the sarcoplasmic retinaculum and from extracellular fluid. Same with the cardiac. Only the skeletal muscle, the source of calcium for calcium pulse is from the sarcoplasmic retinaculum. Site of calcium regulation in the skeletal muscle, the troponin or actin containing thin filaments, the troponin. While in cardiac muscles, troponin and actin containing thin filaments, the same with the skeletal muscle. While in the smooth muscles, calmodulin in the cytosol, calmodulin, myosin in smooth muscles. Presence of pacemakers, there is no presence in skeletal muscles. In cardiac muscles, yes. And yes, in smooth muscles also. In unitary muscles only. Effects of the nervous system stimulation, excitation on the skeletal muscle, excitation or inhibition on the cardiac, excitation or inhibition on smooth muscles. So the same cardiac and smooth muscles, effects of nervous system stimulation. Speed of contraction slow to fast in skeletal, while in cardiac is slow, speed of contraction, while in smooth muscle the contraction is very slow. Rhythmic contraction. Skeletal muscle has no rhythmic contraction. Cardiac muscle, it has a rhythmic contraction, like the beating of our heart. No? And smooth muscle, yes, there's also rhythmic contraction, like the uh, our peristaltic movement. Response to stretch. Contractile strength increases with the degree of stretch. Uh, and cardiac muscle, contractile strength increases again with the degree of stretch. The same with the skeletal muscle. While in the smooth muscles, stress relaxation response. Respiration, aerobic and anaerobic, while cardiac muscles is aerobic only. And for the smooth muscle is mainly aerobic. So naming of skeletal muscles. So the skeletal muscles are named because of its location, its shape, its size, direction of the fibers, number of origins, uh, location of attachment, and action. Often several criteria combine action, like for example, the extensor carpi radialis longus, another name for the extensor of the hand. So its location, like for example, skeletal muscles in the intercostal spaces, in between the ribs, we call them intercostal muscles. The temporalis muscle in the temporal bone of the skull. So it is named according to its location. The shape, like the deltoid, it's a delta, like it's a fan shape muscle. The trapezius muscle, it's like a trapezoid in form. The gluteus, according to size, maximus, minimus, medius. So in between, it's according to size. The direction, like rectus abdominis, internal oblique, transversus abdominis, it depends on the direction of the fibers. Number of origins, like in the biceps, they have uh, biceps or two origin, biceps brachii. So location of attachment, the sternum. So attachment from the attached to the sternum, the mastoid, sternocleidomastoid muscles. So action, like the adductor longus. So they are named differently depending on location, shape, size, direction of fibers, number of locations, etc., etc. So arrangement of fascicles, like circular pattern, the fascicles, they're arranged in a concentric ring, like the muscles with this arranged surround the external body openings, like the anal sphincter. They are circular, or the orbicularis oris, like the muscles of the mouth, muscles of the eyes, orbicularis oculi. The pattern, the circular pattern attached to uh, surround external body openings, the eyes, the mouth, and the anal sphincter. Arrangement of fascicles, like convergent patterns. Broad origin and its fascicle converge towards the single tendon of insertion, like triangular fan shape, like the pectoralis major, the breast muscle, pectoralis major muscle. Arrangement in fascicles, parallel pattern. The length of the fascicles run parallel to the long axis. Such muscles are either strap-like, like the sartorius muscles of the thigh, spindle shape with an expanded belly like the biceps brachii, fusiform in shape. Spindle shape muscles can be described as fusiform. Parallel like the sartorius, fusiform like the biceps brachii. Arrangement of the fascicles like pennate, feather pattern, pennate. Fascicles are short and attached obliquely to the central tendon that runs the length of the muscle, unipinnate or bipinnate or multipinnate. Like the deltoid is multipinnate, bipinnate is the rectus femoris muscles, and unipinnate like the digital extensor digitorum longus, the digit extensor of the digits of the hand. So gross anatomy of the skeletal muscles, like the head and neck muscles, the facial muscles, the neck muscles, trunk muscles, the anterior and posterior muscles of the trunk, the muscles of the abdominal girdle, muscles of the upper limb, shoulder, the deltoid muscles, the elbow, the hand muscles, the muscles of the lower limb, the hip, the knee, the foot muscles. Huh? So skeletal muscle shapes like the orbicularis oris, the muscles of the mouth, circular. The deltoid muscles is multipinnate or feather-like appearance. The pectoralis major, which is convergent. The biceps brachii, the region, the belly, and the insertion parallel, fusiform. The thigh muscles, the rectus femoris, they are bipinnate. The sartorius, which is non-fusiform or parallel, muscles of the thigh. Unipinnate, the extensor digitorum muscles. So muscle shape, depending, naming them depending on the shapes. The head and neck muscles. No? So the sternocleidomastoid. So it attached from the sternum to the mastoid. Uh, the clavicular head. So sternum and clavicle. And then attaches to the mastoid of the uh, temporal bone. So muscles of the head and neck. The part of the head, the orbicularis oris muscle of the eye, oculi, orbicularis oculi. The orbicularis oris of the mouth. These are the muscles here, the levator scapula, the supraclavicular uh, muscles, the scalene muscles, the thyroid hyoid muscles, where they are located, attached to the hyoid bone, to the thyroid, the omohyoid muscle, the sternohyoid muscle, so from the sternum to the hyoid bone. So according to the location, the trunk muscles, pectoralis major, the tendinous intersections, the rectus sheath, the linea alba, the transversus abdominis, the internal oblique, the external oblique muscles, depending on the direction of the fibers of the muscles. The back muscles, the trapezoid in shape, sternocleidomastoid, the deltoid muscles, the erector spinae muscles, the latissimus dorsi muscles, the gluteus medius, the gluteus maximus, the external abdominal oblique, the internal abdominal oblique, the short external rotators of the hip, trunk muscles, muscles of the limb, the biceps brachii, the long head and the short head, the biceps, the deltoid muscles, the triceps brachii muscles, lateral head, the long head of the triceps, muscles of the forearm, pronator teres, the brachioradialis muscles, the flexor digitorum profundus, flexor retinaculum, the extensor pollicis longus muscles, etc. The muscles of the leg, the popliteus muscles of the back of the leg, the gastrocnemius, the tibialis anterior, the location, the extensor digitorum longus, the extensor hallucis longus, or the extensor of the big toe, fibularis tertius, superior external retinaculum. No? So these are bands of tendons that prevents the muscles from bowstringing. So muscular system. Thank you and good day.